Welcome back. You are listening to Charles Landry and Justin Starbird today. Charles, thanks for coming back to the show.
Thank you.
Hey, I'm thrilled to be here with you, man. We're talking a little bit about Landry Osteopathic Healthcare, and one of your treatments that you do is PRP. What is that? What does that mean?
So PRP is platelet-rich plasma. It's a type of injection, and it falls under the category, like the broad category of regenerative medicine. So under regenerative medicine, now there's a ton of things. There's a bunch of different offshoots that have been discovered, but your top three are probably prolotherapy, PRP, and stem cells. And so those are the things, especially people in the sports world have heard a lot about, especially PRP and stem cells with, Joe Rogan's podcast, and a lot of the UFC fighters are all they're advertising and doing tons of stuff with PRP.
I remember Kobe Bryant got hurt and went to Germany. Then came back and he was a whole nother player.
And then Rajon Rondo, I know the guy who did his, I think it was his elbow. He was supposed to be out and he came back sooner. And I'm actually using the same kits that they used for him. So you don't have to go to Boston. You don't have to go to Germany. So they all have their pros and cons. I started originally doing prolotherapy is what I was originally trained on. Prolo is short for proliferative therapy. So it used to be called sclerotherapy, meaning they caused a scar. And then they started doing some animal studies and realized they weren't causing scarring if you do it properly.
So there's like an art to it almost.
Yeah. And it's how you manage your recovery. So prolotherapy was you inject an irritant, usually a really thick, like dextrose, so sugar solution, causes the cells to rupture. When the cells rupture, it causes an inflammatory response. Your body comes in and tries to heal it, and then it lays down new collagen, brings in all your growth factors and stuff to work on that. And for a lot of people, especially young people, it works really well. And that's what I had done for me before. A couple of problems with it. As you get older, it definitely doesn't work as well.
Is that just because the
immune system?
Yeah,
the immune system response isn't as great and as robust. And in dealing with areas with low blood flow, you're getting a boost, but because they don't get a lot of blood flow, you're not getting a great response. So then came along prolotherapy. Not prolotherapy. Then came along PRP. What that does is we draw your blood, like you do for your blood work. You gotta get your cholesterol checked or whatever. So it's a really easy poke in the arm, draw the blood, and then we spin out the red blood cells, and then it concentrates the platelets and the growth factors. And then you can, which is what your body tries to do. Like you sprain your ankle, what happens? It swells. Well, it swells because your body's trying to bring in those growth factors to the area. The problem is what we are automatically taught to do to manage the pain and everything is rest it, ice it, take some ibuprofen. Well, ice may not be that much of a problem, but ibuprofen, Aleve, any of those products that are anti-inflammatories actually stop the healing process. So if you've had small micro tears or even bigger tears to the ligaments and tendons in the area, you just stopped your body's ability to heal. So you've managed the pain, but then you can end up, especially if it happens more than once or if it's really bad, with an unstable joint. And then that can cause problems upstream. So I've had people develop headaches from years after an ankle strain, a bad ankle sprain. My wife has bad TMJ on the left side from a bad left ankle strain. And as we've been doing PRP to her ankle, her TMJ is getting better.
How is that related?
It's just the whole fascial strain and how the body works. So PRP also doesn't seem to. You can still get a limited response on age, the older the patient, but I've got 84-year-olds responding like unbelievably. I think it's, again, you're concentrating the growth factors, so it really depends less on age, I think, than genetics, and that's things they're trying to figure out. Some people have different levels of these growth factors, and they need to figure out which growth factors are and what levels they need to be at to get the best response. Research isn't there yet, so they're working on it. Eventually, I bet you're going to come in and say, "Hey, I'm a candidate for PRP," and I'll do a pinprick, run it through an analyzer, and it'll be like, "Yeah, you have these specific growth factors. You'll do great." Unfortunately, we're not there yet. that's probably 5, 10+ years away.
So right now it's that, hey, I've got a sprained ankle, can you work on me? And, you try it out. And oftentimes it does work,
Right.
but we were not entirely sure why it works on some and not as well on others.
Right. So definitely the success rate for a lot of ligament and injuries and stuff, especially the weekend warrior types, people that are already in good shape, I've done really, really well. Some people that shouldn't do well, people with like collagen disorders, like Ehlers-Danlos, things like that. I've had them still really respond well. They just need a few more. What I like about the PRP over prolotherapy is I've seen tissue damage from the prolotherapy. So people have really bad injuries from it. A friend of mine had it done and then had to have a whole bunch of surgery on her thumb because the inflammatory agent caused soft tissue damage. Didn't happen a lot, but when it happens, it's bad. With PRP, the biggest risk is infection, and as long as you have a sterile transfer and keep the area clean, I've never seen one.
Yeah.
I saw one, but it wasn't. It was someone I did. It was a different collection system, and the collection system was so cumbersome. It was the person got infected, and I think everything was done right. It's just the system was crap, and I don't use that company. The one I have is one of the few that actually has a sterile transfer. A lot of other places I've seen, they use different companies where they have to unscrew the top, and now you have the thing open to air, and then you're sticking the syringe in and trying to draw up the specific amount, and there's no separating agent, and you can remix it and cause all kinds of problems. Mine has a gel system that completely separates the red blood cells out, concentrates. I turn it upside down, draw it up into a sterile syringe, and there's no, it's the easiest transfer system out there that I've seen.
So often there's, no worry about safety or any of those things. It's not this isn't something that's like black market.
Well, and the hard part, trust me, I've Googled and looked on YouTube and looked on all these places doing PRP. Holy cow, the range, it's the Wild West out there, unfortunately, because of it's relatively new. And because it's a human biologic product, you're using your own stuff. FDA is not involved. So then you have to be careful because some places are using non-FDA approved collection equipment, and there's been infections and stuff from that. I mean, when I did mine, I had to submit to my malpractice. Like I have all the FDA numbers for the company that I use, and all the collection system that I use, everything I do was submitted. A lot of places aren't doing that.
Are there questions that people should ask beforehand?
Yeah.
That would help like them identify if what they're doing is, if the, potential person or company they're working with is, on the up and up?
That's kind of hard because again, it's Wild West and there's so many out there. So it's a good question for you to ask, but it's a difficult one to answer. So yeah, you can ask, but sometimes they don't even know. You know what I mean? There was a company that out of China that was making a knocked off product of the company that I order from, and they had a ton of infections. And I bet you a lot of the offices that ordered those supplies didn't realize. They just saw, oh, it's the same brand. I'm just going to order that because it's cheaper. They're having a big sale. You know what I mean? Well, it was completely unregulated from China. Yeah. I only order from my rep. I call the company directly and order. And because I order enough, they give me the best possible price they can. And I only work with them. I won't order from anybody else. I'm not going to go on, some aftermarket supply site and see what I can get. I'm not going to order from all these other Alibaba and all these other ones that you can get perfectly good stuff from sometimes, but if it involves blood, I ain't buying it.
Yeah.
You know what I mean? If I'm just looking for gauze, I don't care. You know what I mean? But if anything that's going to go back into me or I'm putting into a patient, I'm not doing it. Yeah. But I've seen sites, they're doing a knee PRP and they're putting people under general anesthesia. There's absolutely no need for that. Yeah. Unless you have someone with severe anxiety, tons of damage to their knee, horribly needle phobic. It's literally a 1 or 2, sometimes as many as 6, but for a knee, but typically a knee is under 3 pokes. You hit what you need to do. It's a little bit of an ache. It's no big deal. I've got someone with a bad war injury and an anxiety associated with that. Well, we have Pronox in the office, so it's 50% nitrous. Because they were so concerned about me, even just touching their knee causes issues. Okay, just, numbed up the area and did a little Pronox, and the patient was like, that was fine.
Yeah.
You know what I mean?
So you mentioned that you you buy enough from your suppliers, which is because I assume that you do this sort of procedure often,
Right.
and that's so neat because it doesn't necessarily. We were talking about professional athletes going to Boston or going to Germany before it was more well known. What can people expect here in Auburn, Lewiston, in the central Maine area? They don't have to go to Portland. They don't have to go away. They can stay right here in their town.
Yeah. And then, I know one place that's using the same kits that I do in Portland, their cost is higher. But their cost is higher. They got higher rent, bigger staff. They got all kinds of stuff. So their charges even are unreasonable. They're below the national average too. The national average is $1,500 to $2,000 per injection. I start at 540. I can't do it any lower than that. But I keep the price where it's at because it's one of those things where on some people it doesn't work. And you don't know who you are till you try it. So if you're going to gamble, to try to avoid surgery or to manage your pain, I try to keep it as reasonable as possible. And typically, it's 3 injections to know if it's going to work. I tell most people, 1, you may not notice a difference. 2, most people notice a difference.
And this is over how long of it?
About 3 or 4 weeks apart.
Yeah.
So then you do, if after the second visit they have absolutely no response, I give them a choice if they want to try the third. And then it depends on their history too. If it's an area that had a lot of steroid injections in, well, you need to do an additional PRP. Well, what they teach is that you need to do an additional PRP for each steroid injection you've had, to undo the damage caused by the steroid. So, because it's steroid, it gives you immediate pain relief, but in the long run, it damages the tissues and stops the healing process.
Sure.
So you can, so it's important. So if you've had 5 steroid shots in your knee, you're probably not going to notice a difference with PRP after 2. So you've got to realize you got to budget in that way.
Yeah.
But if you've never had any injury to it and you're 35, 45 years old, you have no difference after 2, I'm like, it's probably not worth trying the third. And I'll be honest about that.
So what should people look for, like, in terms of, 1, am I a good candidate for it? And then 2, what are the markers that say that I'm improving?
Markers that say you're improving is a lot of times depending on where you're going, right? Depending if I'm doing a knee or a back. So if I do a lot of back stuff, the biggest thing people say, oh wow, last time, before I couldn't stand at the sink to do dishes longer than 5 minutes. Now, I did the Thanksgiving dishes at the sink before I had to take a break. You know what I mean? Or the recovery, your downtime after activity is less. Okay, I had one guy come in and he hadn't gone hunting in 4 years. And then he came in to me after Thanksgiving, and this is, crotchety old Mainer, and he comes in, and he's like crying. And I'm like, why are you crying? He's like, I went hunting for the first time in 4 years.
Yeah.
And I'm like, really? He's like, yeah. He's like, the PRP was huge. And he's like, I went hunting for the whole morning and I came back. Yeah, it hurt like hell when I got back. But he's like, I laid down for an hour. I got up and I was fine. He's like, before, if I would have tried to do that, I would have been laid up in bed for a week or 2.
Yeah.
That part, to know if you're a good candidate, the healthier you are, the better. The less medications you are on, the better. I mean, it's the typical stuff like that. The less injuries you've had to that area, the better. But I've had people I never thought would get response, you know what I mean? And they do great.
Yeah.
I've had a couple of people like, I thought they did great and they don't respond. That's rare. More often than not, there's a response. The other question people had is like, and I had someone come in like all mad at me and walked out thinking I was an idiot because I wouldn't do stem cells. Because stem cells is the other big one that you hear about. Stem cell works. And the current literature, though, I don't find any difference in response between stem cells and PRP.
So explain the difference and break down, what are the stem cells versus PRP and why you chose to go this route.
Right. So PRP, like I said, is an easy blood draw. Draw it up. And it's like you just go into your doctor to get your cholesterol checked. The stem cells involve one of 2 things, either a fat harvest, so you're having to do liposuction, And it's unfortunate, it's not cosmetic liposuction. You're not taking that much out. You know what I mean? But you have to go with a needle or a trocar, which is basically a big needle, and suck out fat. And then there's risk of that. Like I've had people puncturing the intestine, or anything because they go too deep. You have someone that's not that used to it, and you can lead to problems like that. Or you do a bone marrow harvest, which to do is okay. To have done sucks. You know what I mean? You're basically using a hand drill, going down through the cortex of the bone, then taking a big needle and sucking out the bone marrow. And then you have to harvest the stem cells from that. And there's definitely, it's considerably more cost intensive. Most of the quotes I hear for stem cells are anywhere between $8,500 and $14,000 for a series. Still no guarantee that's going to work. You know what I mean? So I'm like, well, it's still no guarantee that's going to work. Do you want to spend $1,600 or do you want to spend $14,000?
Right.
You know, and there's no real, if it was going to say, well, it's going to make it work that much better, well then fine, but it doesn't seem to be doing that much of a difference.
Yeah, if you have a fountain of youth, okay, no problem. But
right.
But if you're, you know, negligent in terms of the difference, then it makes the value a whole lot different.
Right. And the other thing is the FDA said some things that they basically wasn't in their purview and shouldn't have said anything, but they've made comments about stem cell injections, leading to a lot of malpractice companies refusing to cover you if you do stem cells.
Yeah.
And what they said may not have been untrue, but it wasn't correct and has been misinterpreted. And they implied it, you know, the way they said something, it almost implied it could be dangerous or spread cancer, and there's no evidence of that. And basically, they're also the Food and Drug Administration. This is neither a food nor a drug. Their job is to monitor the equipment to make sure you're harvesting using safe stuff. But as long as I can prove that I'm putting your stuff back into you and not the patient after you, and I have good equipment, it shouldn't matter.
Yeah.
But there's no way even in this part of town for me to start doing stem cells I could do for under $6,000 or $8,000.
Yeah.
And
when you say this part of town, it's because your overhead is less, and
right.
and not the equipment is going to be the same to you, whether it be to some big.
They charge Boston the same as they charge me.
Yeah. It's more the stuff that's around, right? So right. It's the cost of your staff, it's the cost of your location, it's those sorts of things, not necessarily the supplies.
Right.
So to anybody that's listening, we want to make sure that there's a separation there, because one of the neat things that you offer, whether it be, you know, the opportunity for PRP or some of the other services that we've talked about, is that, you know, because your overhead and your business is separate from some of the large organizations, you don't have that those costs, which allow you to pass those savings on. You're certainly not, you know, cheap or a race to the bottom in terms of cost. It's much more about value to you, and right. You know, seeing that customers and patients are getting their best return, because, you know, just from doing a couple of these shows with you, Charlie, it's been really neat to see, you know, your commitment to patient safety, you know, cleanliness, and the services that you're providing are, you know, top of the line, both on the way you administer them as well as technical. So, you know, making sure that that's really clear, right. That where you're saving people is, you know, quite literally by being in this area and providing these services, which is what makes you so, you know, unique to the community.
Yeah, and keeping the staffing small and doing everything I can to keep the cost down. But I mean, the cost they charge for those things, and the massive increase if you can get someone to cover you from a malpractice standpoint is considerably higher if you're doing stem cells, and it's inappropriately so. I'm not saying the companies that are doing stem cells and those things. I think when the research comes out, as it pans out over the years, I think you're going to find that maybe for certain things, one of those things is what certain injuries and certain people are going to have a better response with one over the other. But right now, it's a wash as far as response. So it's so there's a lot of buzzwords people look at. So when the person that came in was all mad and walked out, he's like, I can't believe you're not doing stem cells. And I told him, like, there's no difference in response right now.
Yeah.
So why go through the pain and the risk of the harvesting of the stem cells for something that's going to be the same response that you can get with a simple blood draw? I did definitely, having had both done to me between PRP and prolotherapy, I find PRP hurts way less. You get a lot bigger response for way less. So it is more expensive for a specific injection with the PRP than it is for Prolo. But Prolo, to get a full treatment, is 10 to 15 injections at about $250 to $300 an injection.
Yeah.
So with more risk of potential damage, depending on how you respond to the inflammatory agent, where PRP, it's your own stuff. So the biggest things you can't do for PRP is, I tell people, no aspirin 7 days before, 10 days after, because it affects the platelets. No ibuprofen or any other related product 3 days before or 10 days after. Ideally, no alcohol the night before. Some places say 3 days after. It depends on how much you're drinking. I mean, if you have a glass of wine with dinner, I think you're fine. If you're going to, a bachelorette party or something and you're going to be pounding a bottle of Prosecco, that's not probably the smartest thing to do. But otherwise, you're fine. No smoking. Smoking for any of these things, increases the number of injections you need by at least 50%. Smoking significantly decreases the response. I also ask, if you're coming for PRP, make sure you're hydrated, because I do have to do a blood draw, and if you're a little dry, it makes it a lot harder, and I can't get as much plasma out of you. And people think that's a ton, and they worry and they see these big tubes, and they don't realize the tubes look big, but they don't have a lot of volume. The tubes that I draw are 8 cc's, and to give it a perspective, 5 cc's is a teaspoon.
Yeah.
So when you think of, you're not going to be, it's not like you're donating a pint of blood when you come in here.
Right.
The most I've done is 4 tubes on people. Average is definitely 1. On some people for certain places, especially if I'm doing a low back, it's usually 2 to 3. So then, the cost goes up from there, but I also don't double per tube, and I don't charge you the same price. I do just, basically I do right around cost for the other 2 tubes. For a replacement. So I don't do a markup there either if it's an area that you need 3 tubes in your back. And take it easy for a couple days. CBD is fine. CBD doesn't interfere with it. So if you do have a lot of pain post-injection, which is really rare, but it happens, especially after the second one. The first one, people don't usually notice a difference. Second one, sometimes some people feel like I kicked them in the knee, even though it was the exact same stuff.
Right, but they're building on what was there.
Right.
So yeah,
then the third one, if they get one, doesn't hurt that bad.
Yeah.
I don't know what it is with the second one. Your body just does something, and it's not everybody. But having it done to myself too, I found the first one didn't feel much. The second one was like, ouch. The third one was like, it was no big deal again.
Yeah.
It's just, I think it's a priming thing for your body and how it responds. But you're basically just using your body to heal itself, and you're especially in areas that don't have a lot of blood supply, that when you injure them, they're a problem. And, you're not supposed to use them in acute injuries. I've done it, and I tell people I'm not supposed to do it this way. It's your call if you want to. If it's really acute, like you just sprained your ankle really bad last night, well, I'm not going to do PRP. You know what I mean? I'm talking more like 2-3 months out on the road.
And it's just not healing.
Yeah,
right?
It just doesn't seem to be healing, or really limited. Or I did do someone that was like, he's like, I can't work. He's he does tile, and he's like all over, on his hands and knees, and his ankle's always in weird positions. He's like, I can't work. So I'm like, well, let's do it. And I think we did 2 rounds, and he's like, I saw him the other day, and he's like, I'm gonna have you come in. He's like, I'm gonna come in and do my shoulder, because he's like, my ankle's been fine. It's like I never heard.
That's great.
You know what I mean? So, and that's my goal too. I want people back to work.
Yeah.
And let's do it as, reasonably affordably as possible and as safe as we can. And get it done. I mean, right now I've been doing as many as 2 or 3 a day for the PRP.
And how long does an appointment take?
Usually I book most of them for about 30 minutes.
Yeah.
And that's because it's the setup, the cleanup, and getting the blood. So if you're someone that's really easy, I mean, I can do the whole thing with documentation in under 20 minutes.
Yeah.
But it takes like 5 minutes to spin the blood, and I use a surgical scrub to clean the area. clean all that up and make sure everything's as good. And then I don't typically put numbing medication in because when this is what I've seen problems with some of the studies where they say, oh, PRP didn't work. Well, they actually mixed it with a numbing medication that actually damaged the growth factors. So of course it's not going to work. They used Marcaine and it killed the cells.
Yeah.
So, and also if you add a lot of numbing medication, you're now diluting what you just tried to concentrate. So I'm sort of like, look, the needle I use is the same size needle you get when you get your flu shot. Suck it up.
Yeah.
You know what I mean? And if you need a little bit of Pronox, I'm happy to do that. There's a little upcharge for that because the equipment for that, but not much. You know what I mean?
Yeah.
If you really need the Pronox, it's $50. To get through it. Most people don't need it at all.
Yeah.
It's literally a flu shot. You go in and get it done. Back can be a little uncomfortable, but my biggest success, I do a lot of hips, a lot of knees, a lot of ankles, a lot of backs, a lot of shoulders. Frozen shoulder. So
and it's one of those things like that also helps with arthritis. Yeah. So, I mean, this has been awesome, man. What else should we know about, PRP that you haven't shared?
There's a couple things we can do even on the aesthetic side with it. There's a lot of places that I offer it. Do it for hair loss for male and female having baldness. I had someone with traumatic hair loss. It actually grew back really well. For the hard part with the hair loss thing, right now the studies are showing it's a little over 30% non-response. And it's 2 tubes, so you're looking at $1,000 to $1,200 per session, and you need at least 3. So to be in the 30, I just tell people 30% chance isn't going to work.
Yeah.
And that's not me. It's you. It's just your genetics and whatever. And that's where they're really trying to push the research to see why that's happening. But I definitely don't see that level of failure rate in the injury world and doing ligaments and tendons and joint stuff. It's way better success rate than that. I'd say, maybe 5 to 10% completely non-response, if that. Probably less than 5. It's not a big deal. The other place we do it, people hear about the vampire facial, the vampire facelift. And we do that on the aesthetic side too. So it helps stimulate collagen growth in the face, helps clear up acne, helps with scars. I do it with people with facial scars from either trauma like dog bites or they've had surgery. And they get scars they really don't like or bad acne scarring. I go in there and can do that from a cosmetic standpoint.
Okay.
So we can handle that on the other part of the business too.
That's great. Well, Charlie, this has been awesome to hear about PRP, that it's available in our community, that's available, to patients that, could be struggling with, either chronic, pain or, joint damage, from something before. So, and then to know that there's some aesthetic, benefits as well. So, I think that's been really helpful, and, looking forward to, hearing the response to it. Thanks for having me. No problem.